Welcome to Women in Aging 2010. Our panel today is the beginning of a year-long series of conversations based on polling research that Volunteers of America commissioned from Lake Research that reveals data about attitudes and experiences of aging Americans and their caregivers.
I have to share that I think the worst crisis happens when mom or dad goes to the hospital because they've fallen down and broken their hip and they're not able to even go back to their own home. And we're making decisions at the moment of crisis. I do believe we're going to see more options for folks who want to age in their own homes. And that's a widely supported belief by most Americans. In our poll, 97% of women, 94% of men agree that we should support the right of seniors to stay at home. The other promising trend is that we're going to see a wider consumer acceptance of monitoring technology. We're already using this technology in our independent living and other care settings, and we know it works. It really improves the quality of life for the client. It reduces the number of ER visits and inpatient stays, and it gives peace of mind to a caregiver who knows that mom or dad is okay.
I think this panel came at the right time. I actually am caring for my elderly father-in-law literally just 2 weeks ago. I look at this issue in terms of Plan A and Plan B. I'll start with Plan B. The Plan B was that I made sure I had girls. Honestly, realistically, we have this conversation. My oldest is 15. I have a son who's 12 and 9, and I'm having conversations with them right now about my care. And my plan A is that, and I tell them I'm saving for my retirement. I'm going to make sure that I have long-term care insurance. But this is what we have to do. This is the real thing. We definitely have to do policies, and that it has to be together. But individually, you've got to start now.
So my own mother was 95 last year and developed an acute leukemia. Admitted to a hospital emergency room. Well, right at that point there, the ticker started on probably $85,000 she didn't want to spend. She'd always said, I've had 95 great years, I really don't need any of this. I think many of us would be willing to withdraw from that situation, but what happens is the critical moment comes, you're in the emergency room, and it's like, I want to save mom, and you're dead. I mean, at that point, it's an $85,000 bill, money that really ought to be spent on long-term care and keeping us healthy and keeping those last years terrific, as opposed to a tumultuous and torturous last 4 to 6 weeks.
I think that's a real issue in schools. There's no financial planning. There's no discussion about our children, about what to do with aging parents, about how to have these very difficult and painful discussions. We were talking earlier about none of us know, whether our own parents have saved enough money for their own retirement.
I think we as a culture have not come to terms with the fact that most women are in the workplace, that they are not available full-time to provide care for both children, but what we're talking about today, to provide care for elders, that our workplaces haven't adapted.
But the fact of the matter is, for most average citizens, you can't prepare for everything. You do the best that you can, and that's where public policy comes into place, so that those folks, including those who didn't prepare, get to the point where they have exhausted all their resources, there's some place to go. We are all in this together.
We hope also to convene those of you who are working on public policy, emotional, and financial issues around aging. At Volunteers of America, we're not the only ones, we're not the best ones. We are the ones who want to convene people to bring advocacy, action, and alertness to this alarming trend that will hit all of us in the next 10 to 20 years, if not tomorrow. Thank you.